Hello, I'm Fraser Ratchford with Canada Health InfoWay. I'm pleased to present to you a webinar on eScheduling, which was conducted as part of our ImagineNation Outcomes Challenge. The Outcomes Challenge seeks to accelerate the growth and spread of key technologies in 4 categories. To learn more about the challenge, please visit the challenge website as currently displayed. In the eScheduling category, University of British Columbia Student Health Service was the first place recipient of our Trailblazer Award. During this webinar, they will share their experience implementing and adopting eScheduling and will lead a discussion with others. To start things off, we will play a short video created by UBC for the challenge, and then UBC's presentation will follow.
So that was basically our video from UBC, and at this time then, I'd like to introduce both Kathy Brand and Dr. Patricia Mirwald from UBC Student Health Service, the minds behind this video, and they're going to start off our discussion around eScheduling. They have a short presentation. I'm sure neither of them will mind you asking questions as we go along, because this is what this session is about, is to able to share experiences and discuss the topic of eScheduling. So over to you, Kathy and Patricia.
Well, thank you very much, and this is Patricia, and Kathy and I will go through the slides, and as we discussed earlier, please feel free to interrupt us. So our first slide is really why we implemented eScheduling in the first place. We're a very busy clinic, and in 2009 we probably had about 34,000 visits. And one of our concerns was that when students were making appointments by phone, quite a few of them had to wait too long, and they also asked for convenience when booking appointments, that it didn't happen just when we were available, but that they could do it through the 24 hours. So eScheduling really was a good solution for us. It provided the needed convenience. It gave our patients 24-hour access and decreased just the time waiting in line to book an appointment or waiting on the phone. Students can book from anywhere in the world, and they also have quite a bit of privacy because they can do it from their own computer or their phone to inform our clinic about what the appointment is about. Next slide. So really, we had to look at the whole development was from the initial idea of the system and looking at who are our demographics. We needed to get our team on board, and then we need to grow the patient usage. And finally, we want to talk a tiny bit about working towards further improvement of our system. So really, as you saw in the video, it's a very easy design to allow students to log on. Because at UBC, each student has a unique student number. That's what we've used as their username. And then the student will pick their own password, and that will be something that is only known to them. And I always, when I'm talking to patients about this, I liken it to online banking. It's very similar to that in that you create your own username and password, and also that it's all encrypted. So the student, once they sign on, they can look for a doctor by name, by gender, or just say the nearest available, which would be any in this case. Once they've signed on with their name, they can find the most convenient time. As you see in the top picture, Thursday the 17th, there's really no appointments still left from 9:30, 10, etc. So if those episodes are blank, it's either that we've never put them into the pool to be booked online or that they've already been booked. So you don't see who else is in. You just click to book anything that's available. And then on the bottom, as you can see, patients can easily specify the reason for their visit. So our entire system is using the SSL protocol for encrypted communication, and our records give the student a report every time they log in as to their last few logins. And this allows the patient to let us know if their account was accessed inappropriately. And we've been doing this since 2009, and so far nobody has had a successful inappropriate login. So getting the team on board, we use the process that is from the Institute for Healthcare Improvement Plan, Do, Study, Act. And basically that's taking small experimental steps, putting them into place, and then studying what worked about it, what didn't work about it, and then modifying it. So that's the Plan, Do, Study, Act cycle. So first of all, it starts with having a champion, somebody who uses the system and also understands what we're looking at changing. So in this specific situation, I acted as a champion because as a physician, I use the system regularly, so that we thought that worked well rather than having somebody who was a administrator tell the users how they should be using it. It's better if a user talks to other users. So we informed the staff of the system's use and features and made sure that there was a quite open communication as we were developing it, answering their questions. And of course, one of the biggest questions was, will I be overwhelmed by patients asking for it, and what if the booking doesn't work properly and nobody comes in? So those are the kinds of questions that came up. We continually work towards making the system better and easier for both the patients and the clinicians and staff. So it's something that we always do keep in mind. So we had several principles when we were trying to get our team on board, and the most important one was that privacy and confidentiality of records would be maintained. the privacy of clinicians also had to be maintained because there was actually one of our doctors who'd been actually the target of a stalker in the past, and so she brought up those concerns, and it was important to make sure that privacy of clinicians was also maintained. We decided to hold 25% of all of our appointments to be booked only by our receptionist for same-day access. So we had 3/4 of our appointments were put onto the system. We vary the number of appointments available depending on MD availability. So, for example, this Friday we have fewer doctors available than usual. So for my last hour, instead of having bookable time, we've put those all as urgent access, so same-day access, so that those wouldn't be bookable online today for Friday. And we change it on a day-by-day basis. It's very easy to change what appointments are available. We created very simple appointment types which are fair to all clinicians. So I don't know if you saw at the beginning of the video, but it was something about what types of appointments were good for 15 minutes and what types were good for 30. And also we can, though, vary our system by clinicians. So we have two certified sports medicine specialists who found that 15-minute appointments were not long enough for the detailed work they had to do. So we were able to change for them. It's a 20-minute appointment, and if it's a sports issue, and for other doctors, it'll be a 15-minute appointment for simple issues. So we had a few challenges to make sure that patients were able to use this properly. And one of them is that when we first started it, we felt students needed really clear direction on how to use it. So we introduced a computer into our waiting room for staff to show them how to sign up. We've actually stopped really showing them how to sign up because it's very intuitive, very easy to do, so most of our patients don't need any help with that. We wanted to get as many patients converted to eScheduling to take the pressure off of our reception. As we've grown over the years, we have not increased our number of receptionists, so that it's important that we can take as much easy work off of the receptionist desk as possible and have the students do it themselves. So both receptionists and clinicians remind patients and discuss the benefits of using the eScheduler. And then if a patient forgets to sign in to activate their account, we've had it because it's a student ID number that's easy to remember, and then they just have to ask our reception to reset access and passwords, and that's done for them. So what we found was getting students to activate their account was really our biggest hurdle, because they're very interested in using it while they're talking about their health, but as soon as they leave our office, there's a whole bunch of other responsibilities that they have that are really important for them to pay attention to, so that health may not be the first thing on their list when they get home. So we need to make it more clear so that students can activate quickly, and in fact, one of the ideas is to use the computer in the office, in the reception area, for people to sign on and activate their account before they leave the office. The information on the front page should be really clear on how to use it, the security features and benefits, and also we need to be clear with the patients even more than we already are, to know that they should definitely call in or walk in if there's no openings online, because we do save those 25% each day for same-day access. So our plans for moving forward are to expand our online appointment system by adding the nursing schedule. The reason we haven't done it to this point is that many of our nursing appointments are used for health sciences students to do a full assessment of their immunization so that they can be eligible to work in clinical placements. And depending on answers to a few questions, they may need 15 minutes or a 30-minute appointment. So what we plan to do is have a little questionnaire pop up if they're asking for a nursing appointment, to ask those few questions and then be able to create the appropriate appointment length. We also are wanting to work with our developer, Genoki, to develop a smartphone application which will even increase the convenience of using this much more for students. And also, we have a hope to increase our online bookings, which are now just about 40%, to 60% of all of our bookings over the next year. And I think we are done. Yeah. So we'd be happy to answer questions.
So that was an excellent presentation. So let's open up the lines so that everyone can begin to ask some questions. I guess my first one would be, since I have the floor, I might as well take it. So you said you're currently at 40% and you want to get to 60. What do you think was the one thing that made you be so successful so far?
With the 40%?
Yeah.
I think the biggest issue is that it's a really simple website that is very easy to understand, that students or patients do not need a little instruction before they can use it. If you've ever done any online banking or bought anything online, you could pretty well use our system.
I also think really having it 24/7, because I think like students, like all of us, if they have that free moment, it's going to be in the evening. And in the evening, our lines are not open. So that gives them the option to be at home. It might be 10 o'clock at night, or for students, it could be 12:31. And then they have that ability to go on and make that appointment when they've got the time, not when we're actually telling them this is the open window for you to book an appointment.
Right, right. And Patricia, as being the physician here, you led the charge, but if you were thinking of, and you're in a student clinic, which certainly is its sort of own kind of thing to begin with, but if you were thinking of a community setting practice, what advice, we often hear that clinicians are worried about opening up their schedules for others to book into, and what advice would you have for those clinicians to say, hey, it has worked, it has paid off, we've gained these benefits because of it. So what advice would you have for sort of that community setting practice?
Well, I certainly, first of all, really appreciate the worry over loss of control over your own schedule. However, the benefit that I have found is far outweighs that worry for two reasons. One is that the office itself, your administrator or you yourself can control how many appointments are put out each day. Even if you decide, you don't want to have any online bookings in a certain day, you can it's very easy to change the system such that you only offer the appointments that you want to offer. But the thing that I really liked about it was that if a patient made an appointment for something and then decided a couple of days later that, they actually didn't need that appointment because the issue improved or because they were too busy that day, instead of it being a no-show, they just canceled it. And we've had patients who canceled it at midnight the night before, and at 1 a.m. somebody else takes the spot. So we have way fewer no-shows than we used to have, and the people that we actually see are people who really have a need that day to see us. So we feel satisfied because we're not dealing with a cold that happened a week ago, or somebody's got a stomach upset. They don't have to wait 3 or 4 days to get in if they're worried that they might have appendicitis. We can see them the very next day. If they booked at 1 in the morning, they can be in as early as 8 in the morning.
So how did you come to that 25% of the walk-in? Did you come by that sort of by experience? How did you set that figure?
Well, I think the reason that we started with that was that many years ago, I think it was about 13 years ago, we were acting as a walk-in clinic that students could come in whenever they wanted to and wait to be seen. And I found that particularly distressing because then everybody waited for everything.
Mm-hmm.
So we decided about, 12 years ago to change that to an appointment system. And the worry that we had at that time was that if you offer all of your appointments at any time, then they get booked up too far in advance, that if someone's really ill, that they can't get in quickly. So you can imagine strep throat, mono, bladder infections, gastrointestinal issues that might be something that's surgical, you can't schedule those. They need to get in fairly quickly. So we chose 25% just as a guess 12 years ago when we were doing only electronic bookings through the receptionist, and that has stood us well over the years. When we start to have many more requests for our time than we have spaces to fill, then we know we need to add another doctor. So
okay.
It's a good way of managing your time because we can usually accommodate people who need to be in the same day with the 25%. And for example, this winter we started finding that we were turning away 6 to 10 a day, and then that told us that in the afternoon we had to add another doctor to fit those.
Right. Are any of the other callers, participants on the webinar, experiencing something similar? Have you set the same sort of threshold, or are you using sort of a different process that you wouldn't have that 25% figure? I'd be interested in hearing others' opinion on that.
I have a question. This is Laura Grice from InfoWay. You mentioned that you're trying to grow the percentage of appointments that are booked online. Can you maybe tell us a little bit about some of the things that you're doing to sort of increase the usage?
I'll ask Kathy to bring that up because we have a couple of really great ideas.
Great.
One idea is there's always an incentive when you want to draw people into something. And one of our first incentive was, or one of our ideas was to have a contest for our students that if they signed up and started using the online eScheduling, every time that they used it and had a complete appointment, their name would go into a draw, and we would be drawing for, in our case, we chose an iPad. Again, it was thought that they would have the iPad, and again, in the future, if they were wanting to book appointments, they had the material or the actual equipment right there for themselves to use. That was one idea. The other idea that we're using, or it's not an idea, it's in effect at the moment, we have a signage TV system in our waiting area, and it's set up for multiple reasons. One, we want to get information out to our students, information on our health and wellness. We have videos, we have slides. So this is constantly running in our waiting room for students. When they come in and they're waiting for their appointment, that they have that information available. We did it for many reasons. One, we wanted to cut back on the noise from what the students could hear at the front reception. And two, we wanted to make sure that we had content information being passed on to the students that related to them. So on that system, we're going to have a video showing on how to use the eScheduling, the benefits of using eScheduling, and that'll be part of the constant information that's being actually pushed out to the students, or actually not pushed out, but
shown in the waiting room.
Shown in the waiting room. So another idea is that we have our Nurse and Res program, or Nurse on Campus. We have nurses that go out to the different residents throughout the week, and this runs September through April. And during this time when they're out there, the nurses will be showing the eScheduling on an iPad or on a laptop, so the students are aware that this is available for them to use. And I've always, the doctors, I guess, Patricia, you could explain, the doctors are always promoting it when you're seeing the patients as a means that if they needed a follow-up appointment, and if they don't have time to wait in a waiting area to schedule that appointment before they walk out the door, that they can go online at any time and have that follow-up appointment. Quite often, students aren't aware at that time what their schedule is like in the next few days. They want to think about it, and then they've got that ability to book in the convenience of their own home. The other thing I'd like to add that I find that students comment why they do like using the online is we do like to know the reason why they're coming in. And this way they can write down that reason in the privacy of their own home. They don't have to say it face-to-face to a clerical member or a receptionist when there's other people around. Some are reluctant to do it on the phone. But we find when they're doing it on their own and they're doing it online, they have no problem writing down the reason for the visit.
So the reason for the visit is important because clinically we have about 12 private rooms that can be used at any one time, and almost all of them, but not every one, is set up, for example, to do pelvic exams. So if somebody says that they're tired and then they come in and they say, well, really, I think I might have an STI, they may be in the wrong room. And in a busy clinic, being in the wrong room just takes two minutes off the visit to go and find a room that's available. So it's really helpful to know the real reason that students are in.
Well, I certainly like the idea of you guys promoting a challenge within the challenge. So that's great. And hopefully that student enjoyed their iPad. A question for you then is, what has the Outcomes Challenge done to make you do things differently? Has it caused you to do anything differently than you were doing before, or has it made you think twice about certain things?
Actually, from my point of view, I think being part of the challenge has moved improving our electronic record system more to the forefront of my priorities, and that's been fabulous. Like, we've been working with Genoki Med, that's our software support for, 13 years now, and we've gone through a fair number of upgrades and improved the system. It's a very full system, but you know, sometimes you're too busy taking care of patients to really look at it and decide, should I move up to the next module or whatever. Having this as an example for our eScheduling, we didn't look month to month how many of our patients were. I might have looked at it once every 6 months, but now we're looking at it month over month, and so it's become a priority for us. Our students absolutely love it. They, you know, when they're graduated and they're not able to use student health anymore, they lament the fact that they don't have access to the eScheduling, and they find it really hard to go back to the old phone way.
I agree. I'm still trying to convince my physician.
Well, that's just it, Fraser. That's a good statement, because I know we work with students and they're used to using electronics, but I would be so happy if my GP would go electronic so I can book my appointments. And again, because I think about it, I haven't got time during the day to call the doctor. I would think about it in the evening when I'm at home, and I would do anything. I'd be really extremely happy if she would go that route.
So that said, you guys had your EMR installed for quite a while before you actually went to patient electronic scheduling. But how long did that implementation of allowing the students to eSchedule take? When you made the decision, then what was the rollout, and how long did that take?
I would say the rollout for us was a little bit longer. We were actually the first clinic that Genoki rolled out the eScheduling because it was something that we, I would say, initiated or that we had shown interest in. So we approached the vendor with our idea. So we worked with Genoki to create what you saw today. So our rollout was a little bit longer because we had to start right from scratch.
Right.
For us, it was a good maybe 8 months to work with Genoki to create that application. But now that Genoki has that application available, if you decided to use it, you could virtually start overnight.
Right. Do any of the other callers on the line have opinions on how long it took you to implement the eScheduling portion of your EMR that you're using? Or some of you are using add-ons to your EMR, so it's a slightly different solution. But is it typically, an overnight thing, or 6 months, or anyone want to comment on that in their circumstance?
I'd be interested. How many are on the line right now, Fraser, that are a part of this?
It looks like there's about 5 or 6.
How many of the 5 or 6 actually, if they could just say, yes, I have the eScheduling? I'm just curious to know if it's 5 or 6.
It's Dave in Ontario here. We're thinking and we're going to do eScheduling, but only on our urgent care weekend clinic, because in Ontario we don't get paid, or we get paid just to maintain patients and not necessarily see them. So we're struggling and having a hard time implementing eScheduling because it bypasses our triage desk.
Thanks, Dave.
I did see a wonderful electronic triage system out of, I think it was the University of Florida, for their health service. It was fairly robust, so that may be something that you might want to look at.
When I say triage, a lot of people come in or used to come in for an appointment to get a prescription filled. Well, now our triage desk does that, so they never come into the office, and it's better for us, the patient, not come to the office than come to the office.
Yeah, absolutely.
So this is what we're struggling with, the eScheduling, because it's counterintuitive to the way we're going here.
Although I think I've seen some that are pretty sophisticated in sort of stepping a patient, asking some of those questions that, maybe you can front end your system with some sort of triage that then would prompt them to call versus, ultimately give the patient that decision point of, based on, these few questions you've answered or the type of appointment you're looking for, please call us versus schedule. So there may be some things, Dave, that still sort of honor your sort of family health team setting that would still make eScheduling something that you could go forward with.
Dave's was the last question of this webinar, so that brings this to a close. Thanks for joining us. You can get more details about the Outcomes Challenge at our challenge website. The challenge runs until March 2013, and it's not too late to register. Remember, the sooner you join, the better your chances. Have a great day.